Hello everyone, and welcome back to the channel. Today we are diving into one of the most fascinating and critical areas that connects medicine with law, forensic science, with a special focus on trace evidence and its role in investigations. For those of you studying MBBS or working in medical fields, this topic is not just about crime scenes. It is about scientific reasoning, biological understanding, and medico-legal responsibility that you will encounter throughout your professional life. Now, imagine a crime scene. You might notice obvious signs like a broken window or signs of struggle, but what truly speaks are the things you cannot easily see. Microscopic particles, invisible transfers, and silent biological clues. These are known as trace evidence. At the core of trace evidence lies a fundamental principle introduced by the French forensic scientist Edmond Locard. This is called Locard's Exchange Principle. In simple words, it states that every contact leaves a trace. Whenever two objects or individuals come into contact, there is always some transfer of material between them. When a person enters a room, they may leave behind fibers from their clothes, hair, or skin cells. At the same time, they may carry away dust, fibers, or paint particles from the environment. During a physical struggle, blood, skin cells, or other biological material can be exchanged between the victim and the assailant. This principle forms the backbone of forensic science because it allows investigators to connect suspects to crime scenes and victims to offenders. For medical professionals, especially those working in emergency medicine or forensic pathology, understanding this concept is crucial for proper documentation and evidence preservation. One of the most powerful forms of trace evidence is blood. Blood can confirm violence, identify individuals, and even explain how an incident occurred. In forensic practice, presumptive tests such as the Kastle-Meyer test or luminol are used at the scene to indicate the possible presence of blood. These tests are quick but not definitive. Confirmatory tests performed in laboratories, such as crystal tests or immunological assays, establish whether the blood is human. Once confirmed, blood becomes an invaluable source of information. Beyond identification, forensic scientists study bloodstain patterns. Bloodstain pattern analysis allows experts to interpret the size, shape, and distribution of bloodstains. From these patterns, they can infer the type of weapon used, the direction and angle of blood travel, the position of the victim and assailant, and whether a body was moved after the injury. For example, very fine mist-like bloodstains usually indicate high-velocity impacts, such as gunshots, while larger drops suggest passive bleeding. This analysis often helps verify or challenge witness statements. Another important trace evidence is hair. Although it may appear insignificant, hair can provide valuable forensic information. Microscopic examination helps determine whether a hair is human or animal. It can also suggest racial origin, the part of the body it came from, and whether the hair has been cut, burned, or chemically treated. Hair growth phases are also important. Hairs in the active growth phase may carry follicular tissue, which is essential for DNA analysis. While hair morphology alone cannot uniquely identify a person, it can strongly associate an individual with a scene. Semen and seminal stains are particularly crucial in sexual assault investigations. Presumptive tests detect enzymes like acid phosphatase, which are present in high concentrations in seminal fluid. Confirmatory tests involve identifying sperm cells microscopically or detecting prostate-specific antigen when sperm are absent. For medical professionals, correct collection, preservation, and timely handling of such evidence are extremely important to prevent DNA degradation. All these biological traces often lead to the most powerful forensic tool, DNA profiling. DNA profiling works on the principle that while most human DNA is identical, certain regions, known as short tandem repeats, vary between individuals. DNA is extracted from biological samples, quantified and amplified using PCR techniques. The amplified fragments are then separated and analyzed to generate a DNA profile. The probability of two unrelated individuals sharing the same DNA profile is near zero, making DNA profiling a near definitive method of identification. This technology has solved cold cases, exonerated innocent individuals, and transformed forensic investigations worldwide. As future medical professionals, your role is vital. Whether you're treating a patient, documenting injuries, or assisting in a post-mortem examination, your awareness of trace evidence can directly impact justice. Proper observation, documentation, and preservation at the earliest stage can make all the difference. Thank you for watching. If you found this video helpful, please like, subscribe, and share. And let me know in the comments which area of forensic science would you like to explore next.